Health Promotion, Teaching Prevention of HIV to Young Women in Africa by Natalie Robinson. The problem. At the end of 2010, an estimated over 5 million people living in Africa were on lifelong treatment for HIV. Estimated 1.3 to 2.2 million HIV-positive adolescents in sub-Saharan Africa. Research has shown high rates of unprotected sex by HIV-positive adolescents. In 2012, it was estimated that 35.3 million people were living with HIV, with approximately 2.3 million new infections and 1.6 million deaths internationally. HIV is unequally distributed. It has a much greater impact on vulnerable populations. Of the new HIV infections, 3/4 are adolescent girls in Africa. Of all HIV-positive infections in Africa, 80% adolescent girls living in sub-Saharan Africa. Learning needs assessment. Research from different studies indicates the need for HIV prevention through protected sex, unplanned pregnancies because of the lack of dual contraceptives, and consistency. Lower rate of prevention to mother-to-child transmission. A simple multiple choice survey can be done to evaluate young women's knowledge of HIV transmission. A simple survey questioning the type and consistency of contraceptives used. Counseling to evaluate women's self-awareness and their decision-making and empowerment to have control over their own lives. The health promotion model, the precede-proceed model. The precede framework allows for 3 components: a social assessment of individual needs and quality of life, an epidemiological assessment to identify health promotion needs, an educational assessment to assess factors to be addressed. The precede framework is an ecological planning model because it involves the individual, physical, and social environment. This model is the ideal health promotion prevention for HIV because it focuses on individuals and the vulnerable population at higher risk for the disease. It emphasizes the need to assess the community's ability to problem solve, their strengths, and readiness to change. HIV in Africa has been a growing problem that needs to be addressed in an individual and community aspect. Health promotion and health education plan. The goal is to increase knowledge of the transmission of HIV and increase practice of HIV prevention methods. Behavioral objectives. Number 1, reporting of practicing safe sex by using condoms every time and dual contraceptives to decrease unwanted pregnancy. Ability to communicate 3 different ways in which HIV is transmitted. Increased self-awareness and decision-making and feeling empowered to have control over your own life. Interventions. Number 1, education presented in a PowerPoint on safe sex practices, transmission of HIV, counseling to promote self-help through empowerment and self-awareness and decision-making to prevent HIV. The use of peer educators to educate adolescents on sexual and reproductive health. Research/evidence. An article that emphasized HIV prevention by using dual contraceptives, emphasized the use of dual contraceptives to prevent unwanted pregnancies and further transmitting of HIV from mother to child. Peer educators in the community to help prevent HIV. Peer educators help decrease the spread of HIV through educating stress, increased awareness, impairment knowledge, and encourage behavioral changes. Improve knowledge regarding HIV transmission and behavioral changes. Another article discussed the importance of changing behaviors of unprotected sex and increasing knowledge of HIV transmission to decrease the spread of HIV. Evaluation. An evaluation survey will We'll evaluate the participants' knowledge of ways to prevent transmission of HIV, the ability to speak openly about the risk of contacting HIV and and feeling empowered to make the right decision to prevent contacting HIV. Participants verbalize different forms of contraceptives that can be used to prevent HIV transmission. Conclusion. The way forward is education on prevention of HIV transmission introduced at a young age. The use of peer education programs as an ongoing tool to prevent HIV transmission. Counseling provided in schools to empower young women. Clinics available to provide contraceptives and education on the use of contraceptives. And these are the references I used for my health promotion. There are articles and the book used as well. Thank you, and I hope you enjoyed my presentation.